Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness.
Hello everyone. Should we be treating addictions and substance abuse with traditional medicine or naturopathic remedies? Perhaps a combination of both. Tonight, two experts in their field weigh in with their opinions. Tonight on Living Clean, Living Well, we welcome back Dr. Vera Tarman, who is a regular contributor on the show. Hi there, Dr. Tarman. Good to have you back.
Hi, Teresa.
Yeah, and we also have with us tonight Christina Gordon, a naturopathic doctor. Welcome to our show.
Glad to be here.
Awesome. So tonight starts off a new era for us here on Living Clean, Living Well. As you know, Dr. Tarman has been on. She is Renaissance Medical Director of Health. And we were thinking that it would be a great idea to have a doctor on our show on a regular basis. A lot of our viewers have interacted well, and it's nice for us to have a medical opinion. So Dr. Tarman, as of now, will be appearing every second week on Living Clean, Living Well. So I hope that you are able to use this wonderful resource in Dr. Tarman with her knowledge and her expertise. So Dr. Tarman, this is just a great time for us, and thanks for agreeing to do the show so often now.
Yeah, I'm really thrilled to be coming here every 2 weeks. So I'm thrilled to be working with you, Teresa, and I'm really looking forward to your questions. It's always really interesting to hear the different questions. So please call in. With your medical questions or even your opinions if you don't agree or whatever. It's fun.
Wonderful. So tonight we are talking about traditional medicine and naturopathic medicine. Dr. Gordon, I understand that you treat many patients in your practice with addictions and substance abuse. How do you approach what you do naturopathic ways?
So my mandate as a naturopathic doctor is to treat the root cause of disease. So in this case being addiction. So we use a variety of different tools to help balance the body and make sure that it's balanced in homeostasis.
So from a traditional point of view, Dr. Tarman, when somebody comes in suffering with addictions, substance abuse, from a traditional medical point of view, what are the tools that you have in your toolkit and how do you treat this person?
Well, the tools that we have in our toolkit are, in one way, they incorporate the tools that Christina would use, but we don't. That's not where we put our focus. We put our focus mainly on the sort of stark interventional treatments like medication, or if we're lucky, even a cognitive therapy. They're sort of very. They're interventions that doctor does to patient and doesn't really take into account what the patient can do for themselves. We'd like them to do that, but we're really focused on what can we do, and generally speaking, it's usually on the medication front.
So that flies in the face of really what you do, right, Dr. Gordon?
That's right. We're privileged as naturopathic physicians to have the time to connect one-on-one with the patient. Who are these people? What's their life like? I like to know, do you have siblings? Do you have kids? What's your relationship like? Do you like your job? Are there places in your life where you feel unfulfilled? And what can we do to change that?
And you work with them on their lifestyle as well, right?
Yeah, their lifestyle. So I use a tool called auricular medicine, which is a bioenergetic tool that helps the individual treat the blockages that are preventing them from achieving optimal health. So you could be supporting them with their liver or their digestion, and by treating the liver and the digestive system, you support the nervous system, which when we're stressed, we often turn to our vices.
So she was mentioning she's got time, the way that the practices are set up, but Dr. Tarman, how much time do you have traditionally with a patient?
Well, when I was doing family practice, 10 minutes, 15 minutes. I mean, if it went beyond 15 minutes, I was getting annoyed because I have a room full of patients waiting out there who are getting really mad too. The way that the system is generated, it just doesn't allow for that kind of time. But we know that we need more time. I mean, the family doctor is constantly balancing between their own needs and the patient's needs, and it often ends up being stressful for both. Yeah.
So let's put it out here on the table. How do you feel about the use of traditional medicine in treating addictions and substance abuse? How do you feel about the holistic way of going? Should there be a combination? You're a medical doctor. How do you feel about it all?
I think that if the system could support a complementary approach, that would be great. It would be really great, because what medicine can offer is really quite limited. I mean, it's very powerful in specific venues, but it's stretched to covering areas that it really, I almost want to say, has no business in, or if it does, it can offer very little. I mean, there's only so much that medication can do. I mean, it is not the one answer. Sometimes it's a bridge, sometimes it's a Band-Aid, but we're missing a big piece. And if the system could support something larger than that, great. It doesn't. But if a person can actually, has the motivation to seek out further background support, that's perfect. I mean, it's a perfect combination if we could make it happen.
And from a holistic point of view, Dr. Gordon, what are your thoughts?
Well, I work at the Chelan Health Center. I work with medical doctors and other practitioners also who deal with addictions and relationships. And so I find that a team approach, so that the individual feels supported from a variety of different angles, and the individual tends to you know, share certain things with their medical doctor, different things with a therapist, and you know, sometimes we're just really supporting people as a naturopath to stay motivated and to stay on track with their lifestyle goals.
Tonight we'd like to hear from you. Have you had experience in this area? Have you had a medical doctor help you? Have you had a naturopathic doctor help you? Have you had both at the same time? Do you have questions for them? Perhaps maybe you'd like to get a little bit more information. Well, that's why we're here. Our toll-free lines are now open. Let's go to line 4. Lisa's calling in tonight from Hamilton. Hi, Lisa. You're our first caller. Welcome to the show.
Yeah, hi.
Hi, go ahead.
I'd like to ask a question. I've had severe pain from an injury from years ago, and I've also had a problem with painkiller, which I'm taking. Now, I realized myself that I really don't want to take them anymore, but I need them for my pain. My pain tolerance has been very low. So how does one come off an opiate without having to go on a methadone program, or like I'm in my 50s, put it that way. So, you know, I don't want to take this stuff anymore, but I want to be able to cope with my pain.
Yeah. Dr. Tarman, do you want to start off?
Well, if you don't want to go on methadone, there's also Suboxone, which is another type of medication that people use to get off of an opiate. But if you want to do it without that, I would highly recommend that you try not to, first of all, do it yourself. You know, an opiate withdrawal is pretty unpleasant. You can work with your doctor in terms of a tapering program where you're going off of it on a slow basis, or you can go into a detox and just go cold turkey. But I would not try to do it on my own or on your own at all. I'd do it under the medical supervision or some kind of supervision. But then once you're off of the medication, you'll want to figure out a way to deal with your pain. And you know, medical suggestions, we have a number of things. I'm not sure what your particular issue is, but you know, there's other medications, the whole list of other medications that you can try. I'm guessing you probably have tried, and that's something you'd have to talk to your doctor about too. But I'd actually be interested, Christina, in do you ever have people come to you for chronic pain because they don't have the option of going on opiates from you?
Absolutely. So naturopathically, we would use perhaps acupuncture to increase the circulation. If there's a particular joint or limb that's injured, we do something called surround the dragon. So just to increase the blood flow to the area. We would support the patient with diet and lifestyle choices, so making sure that they're having bowel movements every day, that fiber is a main goal in the diet.
That can help in pain reduction?
Absolutely, because from my point of view, it's all about the way the blood flows. Okay. And so if you're having proper bowel movements and you're eliminating properly, your lymphatic system isn't as congested and your mobility is able to increase.
There's another piece, I don't know, Lisa, if you know this, but if you're taking opiates for pain, one of the things that opiates does in a long-term way is it makes you actually more hypersensitive to pain. And so that when you're finally off the opiates, you may not have as much. First of all, when you're coming off the opiates, pain will be worse because of the withdrawal. But then once the withdrawal is over, you may become less sensitive to your pain just because you're not taking opiates. And even anti-inflammatories like ibuprofen will make you hypersensitive to pain as well. So if you get off of those and try some of the natural remedies, you may actually find that you'll be less sensitive to pain just on that basis alone.
Mm-hmm. And Dr. Tarman, actually, naturopathically, we can support the nervous system with nourishing minerals and sleep, sleep hygiene, things like this, so that people can manage that that stressed out, oversensitive response.
Some good insight there for you, Lisa. Thank you so much for calling in. We're going to take our first break here on Living Clean, Living Well. When we come back, more of your questions, more of your comments with Dr. Tarman and Dr. Gordon. Welcome back to the show, everyone. Tonight we're talking about treating addictions and substance abuse by either using traditional medicine or homeopathic medicine, combinations of both. We are putting it out there to you tonight. Do you have any questions? First of all, for Dr. Vera Tarman or Christina Gordon, who is a naturopathic doctor. So we've got both sides of the equation here for you tonight. They are here for you. So if you'd like to call in, if you have any questions or perhaps some comments, also what may have worked for you. Maybe you've tried both ways of dealing with this. We'd like to hear from you as well. So let's head back to the phones. And calling in from Gatineau tonight is Caroline, who is on line 1. Hi, Caroline. Thank you for waiting and welcome to our show.
Yes, this is a doctor's question. I have about 8 nephews and nieces and great-nephews and nieces. You know, they think pot smoking on a daily basis because online they checked it up and they said it's very good for you. But I find it's very hazardous. So could you tell me the danger that they are in? And then for the Christina, is it Christine? Mm-hmm. My husband has arthritis all over his body. He takes naproxen, but he's in a lot of pain. His knees, and his back, every area. But anyway, is there something he can take to alleviate arthritis?
Well, should we answer that one
first?
first?
Yeah, go ahead, Dr. Gordon.
Okay, so for your husband, well, firstly, from a Chinese medicine point of view, joint pain and arthritis can be linked to a kidney energy deficiency. So making sure that the organs of elimination, like the kidneys, the colon, the lungs and the skin are all eliminating toxins properly. Because another way to look at rheumatoid arthritis is it's a toxicity crisis. The individual is very acidic and oftentimes depleted. So if you make sure that the organs of elimination are working properly and the body is balanced, we oftentimes find that pain improves.
Huh. So there are some options there for you.
Just drink more water, that too.
Lots of water. So I have often heard, Caroline, Dr. Tarman talk about the hazards of marijuana. I know you have a definite opinion on it, so go ahead and you take that question.
Yeah, well, okay. So, it's a pretty controversial area because, in fact, people even talk about marijuana as being a medical option, and doctors will talk about it too. So this is going to be Dr. Tarman's opinion. And you're right, I'm quite opinionated about it because I'm an addictions doctor, and I got to tell you, when I was a family doctor, I used to write those federal approvals for marijuana because I thought that was a good thing to do. But in my work with addictions, I would say, what are some of the hazards? Well, number one, say what you like, it is a gateway drug. It does open up the possibility of just using other drugs, and I'm sorry to say it, but that is the case. I see a lot of people who start with that. So that's number one. Number two, it causes respiratory problems. The incidence of COPD or asthma is increased when people are smoking marijuana. The incidence of psychiatric disorders exponentially increases. Anxiety, depression, schizophrenic type of symptoms increase. And if that doesn't scare your, is it your teenage son or something?
She's, her grandchildren,
oh,
yeah.
Grandchildren.
There's lots of them.
Yeah, okay.
8, I believe.
Tell them that it affects the whole endocrine system. In other words, for men, it will give them more estrogen so that they'll develop breasts. I mean, this usually scares guys, or make them not as virile. In other words, it'll affect their sexual abilities. And for women, it'll mess up your periods. I mean, generally the body doesn't like marijuana, although, you know, it's just the way it is. So there's lots of hazards you can find. I know that people say it's an herb, it's natural, it should be okay, but you know, so is cocaine and so is opium. All of those are addictive, and they're just simply, from my vantage point, not okay.
So Dr. Gordon, you've got a patient coming in to see you, and they're saying, well, like Dr. Tarman just said, marijuana's an herb, it's all natural. What's your response to a patient coming in saying that?
Well, first of all, it is an illegal drug. So, and it does decrease your motivation.
There you go.
You know, yeah, it decreases your motivation. For teenage kids, it can stunt their growth, but the motivation is key. I mean, it's not very likely that you're going to be seeing a naturopath if you're smoking a lot of marijuana.
And it affects memory too.
Absolutely.
Yeah, there's no question about that too.
Yeah, and it actually increases something that a lot of naturopaths treat, which is candida, which causes brain fog, lethargy, and depressed mood.
Well, boy, there's a whole laundry list of reasons
right.
not to use marijuana.
Yeah.
Caroline, I hope that information was helpful for you tonight. Let's go to line 2 now, and Peggy is calling in from Peterborough. Hi there, Peggy.
Hi, thank you so kindly for answering my phone call. I have 2 quick questions.
Sure.
One is, me and a friend of mine, we went to for Bowen treatment, as well as they had this naturopath evaluation where you put your hands on these pads and feet, and they give you the most awesome write-up about your body like you have never seen. You could never go to a doctor and get that kind of write-up in one test. So informative. I highly recommend it. But we had to send our documents to our family doctor. My family doctor was accepting. He didn't criticize. But my friend's doctor threw the documents in the face and said, "You are wasting my time, and what'd you waste your money on this for?" Now, why are we getting this response from family doctors, or what would be your opinion? And
Okay, Peggy, hang on. I'm going to let them answer that. You stay on with us, and I'll let you do question number 2. Go ahead.
It's not sustainable for us to not get along. So we're all entitled to our own opinions, and we're all entitled to finding the healthcare providers who resonate both with us and our family and our health needs. I think that just like when you're finding a naturopathic physician or a therapist, cultivating a healthy relationship with your medical doctor is just as important.
Now, Dr. Tarman?
Well, you know, I think that having a complementary approach makes so much sense, because there are just simply limits to what medicine can offer, and acknowledging those limitations, I mean, you can pick up where we just cannot venture. But the reason why a lot of doctors are so against it is we're just simply not trained in this area. And not only are we not trained, but we're actually subtly not encouraged to pursue these areas, because we're told what we should be pursuing. We have what's called a standard of practice, and that's what we're trained in, and that's what we're expected to practice in. And if we stray outside of that standard of practice, which does not include tests like the one that you mentioned, our college will actually hold us in suspicion. You know, why are you looking at these things? You should be looking at these tests instead, spending time on these interventions, not on these. And doctors who try to do both find that they get overwhelmed, and if they focus just on the one, like these odd tests, they could be in real trouble. So they're really straddling between a system that doesn't, the standard of practice that doesn't support these approaches.
So there you go, Peggy. There's your perspectives, and that's, I guess, what happened. So you said you had 2 questions for us tonight?
Yes. Can I give just a quick experience? My friend, she woke up and she couldn't move both her knees. And her husband heard on TV regarding Nepala, a natural product. And when they took this natural product, within 7 days, my friend was pain-free and could walk. Are you familiar regarding Nepala, which is the prickly pear juice? It is phenomenal for both my friend and her husband.
So funny, I pride myself on knowing some of the natural things, and I haven't heard of this one. Dr. Gordon?
In all honesty, I haven't heard of this one either myself, but I'm delighted that it's working for you.
Yeah. So no, Peggy, we haven't, but thanks for, telling us about it, and I'm going to keep my eye open for that one. Did we answer everything for you tonight?
Pardon?
Did we address everything for you tonight?
Yes, you did. Thank you.
Awesome. Thank you so much for calling in. Let's go now to line 3. Calling in from Aurelia, it's Mike. Hi there, Mike. Have you got a question or a comment?
Yeah, it's Mike from Aurelia.
Hi.
You hear me?
Yeah, we sure can. Go ahead.
I'm calling on behalf of my nephew. I'm in a 12-step program out here in Aurelia, and I've been out here for, I guess I'm coming up on six years clean June 1st. My question, I just have the one question. My nephew has been on methadone for clinic for, I guess, 2 or 3 years now. He was on Oxys and a whole bunch of other things, and I was just wondering, this is my question, I was wondering if there could be something else he could be on instead of methadone that's actually safer, and that's my question tonight.
If you're meaning like a medication, it would depend on what dose he's on with methadone. Sometimes people think that Suboxone, which is another methadone-like substance, is an easier one to be on, less side effects, and easier to get off of. But you have to be on a lower dose of methadone, like 30 milligrams or less, to consider that. But both of them are both of them, it's better just to get off of the methadone. I don't know if he's interested in doing that, but I mean, eventually, the whole idea of methadone is you get on, stabilize, and then slowly taper off. But I know that the times have changed, and so that now a lot of people are on it long term, and that's really going to be the motivation of this person about whether they're willing to actually try to get off or not. Yeah. Yeah, it's possible to get off.
So I think it's important to try to get off if you have managed your addiction properly and you have the proper support network in place, because methadone is really, really hard on your liver, which is your primary filter for your entire body. So I think it's really important to get motivated to wean yourself off that medication.
Yeah, and not only is it hard on the liver or it's hard on the teeth, it's also hard on motivation. I see a lot of people become very unmotivated. They kind of become couch potatoes, as it were, not really doing very much. And when people get off of methadone, they say, wow, I've got all this energy I didn't know I had. They become sexually interested again because methadone really quells sexual interest. So, I mean, tell him that he'll just feel generally better if he eventually gets off of it.
And it'll help cultivate relationships with other people.
Yes, yes.
You mentioned the liver, and we all know it's the filtering system for the body. Is there any supplements that are good for helping the liver?
That's a good question. I get that asked all the time. Please take the floor on that one.
Well, basically, the liver has phase 1 and phase 2 liver detoxification pathways. So it's a really good idea to just Google what the nutrients are that drive phase 1 and phase 2 detoxification pathways. So B vitamins are within that. Glutathione is within that, which is hard to get bioavailable from food. So actually at my clinic, I'm licensed in parenteral therapy, and an adjunct therapy to support the liver would be IV glutathione. And it is very effective in decreasing your liver enzymes.
Are you talking about IV like as in intravenous?
Yes, I am.
Can you do that?
Yes, yes. Yeah, that's within the scope of practice for naturopathic doctors to do IV vitamin C, magnesium. things like this, B vitamins.
Yeah. A friend of mine, she was going to a naturopathic doctor to treat cancer, and she did the IV vitamin C.
Yeah, I do that within my practice as well.
Wow.
Yeah.
So that's good information. So thank you very much. And Mike, thank you for calling in, and I hope that that information was helpful as you help your relative. Let's go now to line 4, and Tracy's calling in from St. Catharines. Hi there, Tracy. Go ahead.
Hi, how are you?
We're good. How are you?
I'm doing great. I just wanted to make 2 comments. In 2009, I was a pedestrian hit by an SUV, and I ended up with 13 herniated discs. And so I'm always constantly in pain. And then to add to that, I have diabetic neuropathy pain. And so I have sciatic pain, neuropathy pain, and then I broke the navicular bone in my right foot. And so again, lots of pain in that foot. And so I did a lot of research on marijuana as an option for pain relief because I have a lot of times difficulty sleeping. And so I looked up sort of the different topics about it, and I found out that our brain is actually wired. We have neurotransmitters that will receive the THC that is in marijuana. So I'm just curious as to why that wouldn't be a natural option if our brains are wired to receive that THC.
Okay.
Well, I mean, it's the same phenomena that happens in that when I take an opiate like a Tylenol 3, it's going to a natural receptor in my brain that's called an endorphin receptor because I have natural endorphins that are pain relievers. And what Tylenol 3 and all of the opiates do, like OxyContin and all the rest of them, is they mimic that natural opiate that I make myself called an endorphin. So with marijuana, we have receptors that have actually just been discovered in the last, I think it's the last 10 years. It's called the imatidine receptor. But what the actual neurochemical is that goes to that receptor and what it actually does remains unclear. We haven't found it yet, and we don't know exactly what it is. We think that it has to do with pain management because marijuana apparently helps for pain, and we think it has to do with the stomach, not like appetite, because you get the munchies when you smoke, and when you stop, you get very irritable, sick, nauseous. So we think it has to do with those things, but what it actually is, we don't know. But the fact that there is a receptor, that's the same as any other drug that works. There's a receptor. But the question is more, we make our own natural endorphins, and we don't become addicted to them. Although I suppose you can if you're a runner's high, you can get addicted to running. But with marijuana, I mean, the issue isn't so much the actual neurochemical, it's the amount of, when you're taking a drug, you're getting far too much. It overwhelms the brain. It's not supposed to get that much, as it does when we take a drug like an opiate or cocaine or marijuana. It's more a matter of degree. It would be better if we could find a natural way to enhance our own natural neurochemicals, which actually fits well with a naturopathic approach. If we could find some way to tap into our own natural way, like how do I get my own natural endorphins? By exercising. How can I get my own natural THC? We don't know yet how to do that, but that would be a much better and safer approach.
Yeah, but Tracy can't exercise because of her accident.
No, but that's the endorphins. But what it is about THC, I don't know. Although I actually think there's probably an endorphin link because endorphins also cause nausea and are for pain.
Dr. Gordon?
I just think that it's unpredictable how you'll react to the marijuana. And it's not exactly a long-term solution because it's likely to, it's not physically addictive, but it is socially, and the practice of doing it nightly isn't exactly the most effective way to deal with the pain. In my practice, I would treat pain with acupuncture, as I've mentioned, also homeopathic remedies. Sometimes the nervous system is stuck in that shocked response from the pain. So just using something as simple as arnica montana, a homeopathic remedy, could be effective, and magnesium, things like this.
Tracy, do you have any other questions?
I had one more comment. In my search for pain management, I ordered the NutriBullet, and so what I've been doing is I've been juicing a lot, and I've done some research on the different protein seeds that are available, and I have found that I use a hemp seed, a flax seed, and a sesame seed, and they also have decreased some of the inflammation that is a result of the pain that I have, plus the antioxidants in the fruits. I use blueberries, blackberries, raspberries, and cranberries, and then I mix that with spinach. So that has helped, but it's still a far cry from, you know, wanting full pain relief.
Yeah.
But that's
outstanding.
yeah, no, it's really outstanding, and because your body is managing pain, using the NutriBullet or the Magic Bullet or a Vitamix to break down your food so that your body doesn't have to work as hard to digest and absorb that nutrition. So that's really effective, first line. But basically, to manage your level of pain, you're going to have a multifactorial approach. So that's one good place to start, but just keep going, because it sounds like you're really on the right track.
Yeah, I love how proactive you are,
Yeah.
Tracy, and obviously researching so many things. You know what? Thank you so much for your insight tonight. I had put it out there for people to call in on what things have worked for you. So Tracy, thanks very much for picking up the phone tonight. We're going to take another break here on Living Clean, Living Well. When we come back, more of your questions and your comments with Dr. Tarman and Dr. Gordon.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here. We've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course. It's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call, we'll get right back to you.
Welcome back. Tonight my guests are Dr. Vera Tarman, who is the medical director at Renascent, and also Christina Gordon, who is a naturopathic doctor. And tonight we were talking about treating addictions and substance abuse using both traditional medicine and also homeopathic remedies. Combination of both, maybe one way or the other way, and it's been an interesting, so far, first half of our show. Just before we get back to it, I'd like to tell you about an interesting resource for you. It's Recovery Wire magazine. We have had the editor, Dee Christensen, on the show to tell us about it. This is a magazine for people who have been impacted by addictions. Very trendy, very thought-provoking, and it is a recovery-based magazine. The best part is you can get your free subscription just by going to their website at recoverywiremagazine.com. So there you go. We've got a good resource for you. I've got 2 questions holding here, but just before we go, we had talked about the liver and the fact that it's the body's filter system. What can you do to, I guess, guess if we're, if somebody's dealing with addictions or substance abuse, what can you do to help your liver that's probably overtaxed? Dr. Tarman, you had a question. Go ahead. You're calling it on line 4 tonight. Go ahead.
I have people asking me all the time, like, in my work with addictions, a lot of people have hepatitis C, or they've really exhausted their liver because of alcohol abuse. And they often say to me, what can I do to help my liver? And, what about milk thistle? Is that a good idea? And I always say, well, I've heard about it. I think it's a good idea, but I'm not really sure. So we got a great opportunity to ask a naturopath.
And I go on a big cleanse a couple of times a year, and I'm always told, and it's listed right there, milk thistle. So go ahead, Dr. Gordon. Tell us about it.
Yeah, so milk thistle is a renowned herb because it's a hepatoprotective. So it's going to protect your liver cells from damage, which we like. However, I don't think that herbs should be just taken haphazard. I think you need to consult a herbalist or a naturopathic doctor to find out if something even as simple as milk thistle is right for you. And I do think that if you do decide to use it, because it is a relatively gentle herb, that you shouldn't use it for an extended period of time. Something like 3 weeks, and you need to rotate, so to avoid hypersensitivity and also just habituation and it not working as well.
So the body gets used to it.
Yeah. So then
just like medication.
Yeah. Milk thistle, dandelion root. So a tea of dandelion root is really, really effective for draining the portal vein of the liver. B vitamins, dark leafy greens, which are absolutely effective. Everybody loves kale these days on the menus, and kale is an oral chelator. So what that means, it'll bind toxins and pull them out of the body through your colon.
Good old kale.
And lemon water, a naturopathic favorite.
Wow. Oh, good.
Well, good. There's some good tips there.
There's a plethora.
All right. Back now to our phones. Let's go to line 2, and Amanda's calling in from St. Catharines. Hi, Amanda.
Hi, how are you?
Doing good. Have you got a question for my guest tonight?
I do. Question, comment, I don't know.
Go ahead.
Request, maybe?
Sure.
I've always, as a teenager, I socially experienced with, several drugs, but nothing intravenous or anything too hardcore. Not something that took advantage of my life. However, in my older, my mid to late 20s, I started experiencing some chronic pain. I've been to pain clinics, was put on high doses of pain medicine. Doctors can't get over the amount of tolerance that I have. And I find now that they see I have an addictive personality. They've cut me off the pain meds. That's when I turn to alcohol. And when I drink, it's not pretty. It's completely antisocial. It's not like it used to be. I drink pretty well to put myself out. I've been to treatment once. I went to treatment last summer. I came out after 24 days, felt great, relapsed the next day. I'm going to Homewood on Wednesday. And I'm just scared that it's not going to work.
Oh, Amanda. When you have a patient that comes in and says they're, just bottom of the barrel and scared, what would you say, Dr. Tarman?
Oh, well, that's a hard one. I would say, first of all, you're not alone at all. This is exactly how people feel when they enter a detox or a treatment center, or just think about stopping, because you're putting down probably your best friend at the moment, which is alcohol. I would say don't do it alone. You're not alone, and you don't have to be alone. Going to either a detox or a rehab is, even if you've been before, is, if nothing else, it's a very contained, safe place, which it sounds like you had that experience, and you can go back into that and sort of get yourself in a comfortable, safe place. And then it sounds to me like you relapsed the next day. Did you have something in place for the moment that you left the rehab? Because it sounds like you need that. You need to build that safety beyond the 28 days or the 21 days. If that can be a support, you got to build your supports. I mean, the 12-step program is a great way to do that. Sometimes people go to 3 meetings a day, and it's not because they need to hear the message 3 times. They just need to be around people all the time. And sometimes people will do that for a month, 2 months, 3 months. They say 90 meetings in 90 days because they want you to get that support on a regular basis. It's not that feeling of trying to do this alone is tremendously disabling. So if you can get your supports, that's great support. Yeah.
Dr. Gordon, did you want to talk to Amanda?
Well, Amanda, it is a really tough situation given that you've been there before. But building bridges, I agree with that. Community, try to get yourself busy. Don't have too much time on your hands. So, yeah, whether you're volunteering, you know, even going to a neighbor, say, hey, can I help you with your yard? You know, reach out to people and try not to be too negative in your self-talk because it's a vicious cycle. So you need to think about, just brainstorm within yourself, what are the things that you used to do when you were a little girl and you really enjoyed? So, was it going for long walks or playing dolls with your friends, drawing, whatever it is, just start pursuing those things that before you had alcohol, what were those things that filled you up?
Then, Amanda, I sure hope that helps, and I'm glad that we were here for you tonight as well. It's the start of a new era for you on Wednesday, and I'm sure that Home would be able to give you some tools for that toolbox as well that you'll need to get you through the upcoming weeks and also when you come out. And please, I hope that you're able to watch our show again, and I'd love to hear from you. Please call back in and let us know how you're doing and if we can help you again. Let's go now to line 1, and Bill's calling in from Hamilton tonight. Hi there, Bill.
Yes, sorry, at night.
Hi, doing well. How about you?
Fine, thank you. I actually have been involved in addictions and worked the front line for many years, and I called last week, and I wanted to have a little bit of advice or some sort of an idea from you guys with, I've seen, specifically with the opioids, the fear of detoxification, and I've seen a lot of people come in and go on methadone, which just seems to lead them down even a worse road to recovery. It just seems to enable them, and that's been my experience. Now, I heard of another drug that they were using was called Suboxone. Now, I don't know much about it, but what would you recommend homeopathically without going back to a drug? Like, what would you recommend that it seems to be once we get them involved, it's the fear, or somebody that relapses off an opioid, it's not that they don't want to recover, it's the fear of the withdrawal. Is there anything out there outside of being clinically put into an endorsed coma to get these people through it? What could they do? What could you say to them to help them get through this in not daisy manner, but in a manner that they would be able to cope with? I'm just looking for advice, like kind of homeopathically, or is there a way out there to do that?
Good question, Bill. Dr. Gordon.
So that's a really challenging thing because I think it's all about the environment. Is the individual in a safe enough environment? Is there enough things in place to support that person through that difficult time? So basically you need professionals and family and loved ones holding space for that individual who's cleaning themselves up, and remind that individual that this pain is not permanent, and it's pain for a positive reason. Because if you don't go through this pain, you're not able to fulfill a life. You're half asleep, and it's very painful for loved ones to see that. So if you're not able to do it for yourself, I ask people to think about their loved ones and let that love inspire them. So additionally, homeopathically, homeopathic medicine, maybe I could just explain, is a little bit different than botanical medicine. So homeopathic medicine works by the principle where like cures like. And where I find in my practice these homeopathics are super, super effective is because they treat an emotional temperament. An emotional temperament whereby you don't know how an individual responds to stress until they're pushed up against that wall. So these homeopathics manage that sensation of emotional chaos, quite frankly. And then it's really important to just implement routine. So, you know, waking up, going to sleep, eating good food. So a lot of my patients, when they're detoxing, I recommend that they eat something as simple as oatmeal, because oatmeal is a nervine tonic. And bananas are really effective as well, apricots. Things that are high in minerals and will nourish the nervous system can be very effective to decrease the discomfort of detox.
Mm-hmm. All right, so there you go, Bella. I hope that that was helpful. It sure was helpful for me. Boy, I learned so much from both of you this evening. We're going to take another break here on the show, but when we come back, we're going to come back to more of your phone calls. Dr. Tarman and Dr. Gordon are my guests tonight. We'll be right back.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
List anyway.
Yeah.
Welcome back. We are learning a lot tonight on Living Clean, Living Well. Our topic tonight is addictions and substance abuse. How should you treat it? Do you do a combination of traditional medicine and homeopathic medicine? What works? We've had some people call in tonight with their experiences, which have been great. My guest tonight, as I mentioned before we went to break, is Dr. Vera Tarman, and I also have Christina Gordon, who is a naturopathic doctor. So we've got both sides of the equation for you tonight. Let's go back to our phone lines. And holding on line 5 patiently from Toronto is Margaret. Hi there, Margaret. How are you?
I'm fine, and how about you?
Good, thank you. Have you got a question or a comment tonight?
Yes, I do. My son has been on marijuana, and he went off of it altogether in January. And my point now is he's not having much help with his doctor. So I'm wanting to know what can we do? He's not sleeping, and he's really not motivated by anything. He really needs help, and I find that there's not much help out there.
Dr. Tarman, do you want to start here?
Sure. Well, first of all, I want to say that we're actually finding out that marijuana does actually have a withdrawal pattern, and as a consequence, we're actually saying that it is actually not physically addictive. And some of the things that you mentioned are part of that withdrawal pattern: agitation, inability to sleep, restlessness, strange dreams, sometimes even shakes and sweats. And the thing about marijuana, which people don't know about unless you work in the field, is that those are symptoms that can go on for a long time. So you said it was January, and now we're now into where are we? May. So it should actually be done by now. But anyway, where alcohol is, the withdrawal pattern is 1 or 2 weeks tops. With marijuana, it can be a month, 2 months, because it's stored in the fat cells and it goes out slowly, and so the withdrawal pattern is quite long. So some of his symptoms that you've been noticing might be just withdrawal. And then the next thing is, I mean, now he's in a situation where he's put down his drug, but unless he's getting some kind of support, which that's not a medical, medicine, frankly, doesn't care. Once the person's off the drug, their job is finished. Now the job is he's going to need to get social supports, social service supports. There's actually an MA, Marijuana Anonymous group, a set of groups in Toronto that he can try to find. But he's going to have to find something to help him, but it's not in the medical field, so stop looking there because, I mean, he might get some kind of therapy, but it won't be focused on marijuana.
So Margaret, maybe you could suggest to him that he could maybe go online and Google Marijuana Anonymous in Toronto, and perhaps maybe there'd be some support services there.
Yeah.
I'd love to hear from Dr. Gordon, and perhaps there's something he could do homeopathically.
Well, actually, to manage the insomnia, a good remedy is melatonin, which has just become legal in Canada. And it's very safe. It's even safe to use on young children. That's how the study was done on young children to allow it into Canada. Also, just a liquid calcium magnesium at night, like 2 tablespoons. And then, you know, sleep hygiene. So not watching TV after 10 p.m., reading a book, relaxing, deep breathing, relaxation. But it sounds like, too, we have to always think about, is an individual's world or frame of reference becoming too small? So getting involved in community, volunteer work, as parents, supporting children and empowering them to make those kinds of choices is really, really effective, I find.
Yeah, I'm really glad that you mentioned about sleep because that is the difficulty in sleeping is a problem for almost any drug the person gets off of. If it's marijuana, if it's alcohol, if it's cocaine, trying to get back a natural sleep rhythm is really, really. It sometimes takes a long time.
I think it's about cultivating a nighttime ritual, you know? So after dinner, you might have a bath with Dead Sea bath salts, or have a cup of tea with your partner, or invite a friend over. I have a patient who has Moroccan mint tea with honey with one of her neighbors every night. So there's lots that can be done. You just have to get creative.
And be willing to do it.
And be willing to do it.
Margaret, I hope that you were jotting all that down. You got some really good stuff there. Was there any more that you wanted to talk to the doctors about?
Yes, would this affect the brain, like to an extent that it would do really bad damage? Like he's been doing it, like say, a long time, like 15 years.
So you're wondering whether or not he suffered brain damage from the previous drug use?
Yes.
Dr. Tarman?
With marijuana, I have to tell you, I don't really know what the long-term consequences of that are. Certainly we see that there are some emotional, mental health consequences, like increased anxiety and, like I said, schizophrenic episodes. But I think that as the person gets further and further away from using it, I don't know if those things are permanent. But in terms of actual brain damage, my guess is we know that when the person is smoking at the time, that it really, really, really affects memory. But my sense is that comes back over time. But it's going to probably take more than a few months. Usually these kinds of things take a year or two to sort of return back to normal functioning.
I think it's also about working with a therapist to cultivate coping skills, because if you don't deal with that underlying issue that brought you to using these substances in the first place, your child can appear that they're not as able to participate in activities of daily living. But I do believe that you can regenerate the brain, that you can develop practices that, like, there's a book called The Talent Code, and so it's all about just the practicing things. Through practice, you can develop new brain pathways.
Yeah, one of the things that happens with teenagers when they start smoking or using any kind of drugs is that, the time period of teenagehood is, that's when we develop we learn how to develop our coping skills in the first place. And if the person is smoking, using drugs, whatever, they haven't spent that time learning those tools. So that now is the time to learn. So you're right, that this would be the time to get a coach, to get some kind of essential training that they didn't get at that time when they should have been getting it.
Margaret, I sure hope that that's helpful for you tonight. One of the other hot button topics that we've been dealing with over the course of the last few months, there's been a lot of people dealing with depression. And I'd love to hear from a naturopathic point of view what some of the things are that people could do, you know, depression and how it relates to their addiction and recovering.
Absolutely. So in my practice with my patients, I treat a lot of mental health. And it's a combination of things. So basically, holistic nutrition, a diet with variety. A lot of times mental health problems are actually just allergies and hypersensitivities that deplete the nervous system. There's correlations with the blood type diet, which I actually use a lot of in my practice. Blood type O, for example, is more susceptible to bipolar. And they need, you know, a diet that really supports alkalinity and proper blood flow. Because they're susceptible to kidney problems with high uric acid and high cholesterol. So I think that, you know, we now know that, you know, fish oils are really healthy and supporting managing stress, B vitamins, and I often tell my patients the more stressed you are, the more minerals and vitamins your body requires to manage the body's reaction to that stress. So for example, vitamin C is a key component in dopamine. So really boosting your nutrition and your minerals and vitamins is absolutely paramount if you're dealing with a mental health issue.
You know, this is when people ask me about, can you suggest some vitamins? I mean, I am not trained in this area, so so tell me if this is what I tell them. Tell me if I'm right. I say you should always have one multivitamin to start off with, essential like fish oil, some kind of fish oil supplement, vitamin D and magnesium, calcium.
I would agree with that. You know, generally speaking. Yeah. Generally speaking, yeah. So, but regarding the oils, I think it's really important not to use salmon oil because it's sourced from farmed salmon, which is absolutely going to have health ramifications.
I won't even buy it in the stores.
Yeah, you have to be very careful.
Just sit in those cesspools of toxins.
Yeah, and so you need to make sure that if you're going to use a fish oil that it's pharmaceutical grade. And I think it's really important to rotate your oils. So using the fish oil, an evening primrose oil, a flaxseed oil, which is sensitive to oxidation. So different oils, lots of variety, olive oil. Very healthy. And making sure, as I've said before, that your organs of elimination are functioning properly. So even if you're adding more nutrition, if you're not having daily bowel movements, that's where you need to start.
What's your opinion about Metamucil?
Oh,
we don't have time.
We don't have time for that. I'm so sorry. Well, we're going to take another break, but when we come back, some final thoughts.
Okay.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here. We've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course. It's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call. We'll get right back to you.
Welcome back. Just to follow up, just before we went to break, Dr. Tarman was asking about Metamucil. Your thoughts on that, Dr. Gordon?
I prefer for my patients to use psyllium husk, which is the active ingredient in Metamucil because it doesn't have sugar.
Yeah, there we go. So naturopathic remedy for you. All right, so some final thoughts. Dr. Tarman.
Well, I'm delighted that we covered this topic because I think it's really great to hear an alternative to medicine. Like I said, we have limitations, but there are other solutions beyond that, and I'll just leave it at that.
Yeah, Dr. Gordon?
Well, I believe in a complementary approach, and it's really important to meet the patient where they're at. So whatever level they're at, that's where you have to start interacting with them.
And we thank you so much for what you called in tonight with some of your experiences as well. It was great because it was really nice to be able to share. And like you said, Dr. Tarman, to explore this subject tonight as we talk about traditional and homeopathic medicine. So a big thanks to you both.
Thank you.
I have learned so much. Coming up next week, we're going to be talking about family therapy, and we have got noted family therapist Hamish White coming in, along with Ali, who will be our guest next week. I'll see you then, everyone. Good night.
Living Clean, Living Well has been a presentation of the Canadian Centre for Abuse Awareness.